Welcome back to 3+U. Well, we always try to keep you up to date on the very latest medical information out there. And hernia is something that a lot of people have suffered through. A lot of people may have a pain in their side. They're not really sure what it is. Could it be a hernia? We're here to unshroud the mystery. We have Dr. Daniel Heithold. He's general surgeon with CHI Memorial Surgical Associates. And Dr. Heithold, first of all, there's going to be a great screening event. What is the screening event for, and when is it? So
October 2nd at Memorial Hospital from 4:30 to 6:30, we have a group of surgeons that will be there gathered to give some talks about what a hernia is, the symptoms. I'm going to give a talk on how robotics has changed the course of treatment, and we will have a demonstration of the actual robot that helps us perform the surgeries.
And I want to get into that more in a second. It's called the Da Vinci machine. And it's pretty fascinating. It's amazing how technology and humanity combine to just achieve some great things in medicine now. Let's focus first of all on what a hernia is. What is it specifically?
So the abdominal wall is made up of several different layers of muscle, and they combine in different ways to help us move and to protect our organs and to have us have a protective barrier. So if there's a weakening in the abdominal wall anywhere, then the organs or the tissue can protrude through that weakening place. Depending on where it is the type of hernia that we have.
And when you say the abdominal, are we talking about just this whole area, and it could take place anywhere?
Yes, so the majority of what we're talking about as general surgeons is between the chest and the pelvic bones.
Okay.
And the majority of all the hernias are more likely in men or in the groin. You can also have them from previous incisions, which are common. You can have them as a hiatal hernia in the diaphragm, where the stomach protrudes into the chest. And so they all have different types of repair and different treatment options.
So somebody that may be suffering a hernia, they don't even know it. You say that it's possible that you have a hernia. You may not even know it, but you're feeling what?
Right. So many people have a bulge or a fullness or some pressure or even pain in the groin, or they could have it in other places depending on the type of hernia that they have.
With women, childbirth, my understanding is a hernia is a fairly common thing.
Certainly childbirth can cause umbilical hernias around the belly button. During pregnancy, the abdominal wall gets more lax. And also the pressure, which is a big majority of the cause for hernias, is greater. That also increases their risk for hiatal hernias in the diaphragm.
So once a hernia is treated, is that area susceptible? Is that generally a weak area in the abdominal wall? Could another hernia come along shortly?
So that's our goal, is to diagnose it properly, and with imaging and surgery now, that we hope to fix it properly the first time, because the best time to get it fixed is the first. After, if it comes back, then that tissue is weak and it's just more difficult to repair.
Well, let's talk about the event in a little bit more detail. Again, it's coming up. It's a hernia screening event, CHI Memorial, Tuesday, October 2nd. That's this coming Tuesday, right? Yeah, this coming Tuesday. And the Da Vinci machine, I think, is going to be really cool. Tell people about that.
So the machine will be at the event, and we will have hands-on experience where the public can come and actually sit at the console. That will show you the 3D depth that we have that is not available with laparoscopic surgery. You will actually get to move the arms like we do, and just really appreciate how refined the movements are and how exact it can make our surgeries now.
And with surgery in general, are we almost to the point where we're not even opening people up anymore? Where we can just, with robotics and microscopic surgery, or I'm probably using the wrong terminology, but.
Well, certainly minimally invasive surgery.
Yeah.
We still have to make incisions to get these little tubes through which we work, but in general, the incisions are getting smaller, and the options that we have for all types of general surgery with the robot are available to us. Not just hernia, we can do just about any procedure we do robotically now.
And one thing that that I appreciate, because I never want humanity taking out of stuff. I never want a robot operating on me. I want a person behind the controls, and that's what you guys want to focus on specifically. Is yes, you can do much better surgeries, you can do much more precise surgeries, but it's you doing the surgery.
Right. We get that asked a lot. So the difference with the robot is that there is 2 cameras that are showing us 3D depth, which we've never had before with the laparoscope surgery. And also the refinement of the movements is much more than even our own capabilities for our wrists.
Well, Doctor, I would encourage anybody who has a general interest in medicine and technology to come check this out. Not only will you be able to experience the Da Vinci machine, but also people can be screened. So if somebody does have some kind of a soreness and they're thinking, okay, that sounds like it might be a hernia, doctor, is this something that they might want to come to also?
It would be fantastic. So this is free screening. If you're concerned that you may have a hernia, there will be plenty of us available to try to assist you and talk to you about options, or if you have a hernia, or what other steps you may need.
And there's the website, memorial.org/hernia screening. Go there, get all the information. It's CHI Memorial Community Rooms, Tuesday, October 2nd, 4:30 to 6:30 p.m. Slide on in there after work, and I think you will be fascinated by what you see. Dr. Heithold, I appreciate your time very much, sir. Thank you much.
Thank you
and
very
we
much.
will take a quick break and have more 3+U right after this.